Hello, everyone. Welcome to the Flint Community Webinar, your community resource every Friday at noon. It's nice to be with you again. We've got a great lineup for you today. We've got some great expertise. We've got Nurse T and Dr. Gordon here with us today. We've got Lynn Williams, Director of Equity and Community Engagement with the Community Foundation of Greater Flint, who's going to talk to us a little bit about their project and truth, racial healing and transformation. We've got Dr. Russell here with Genesee Health Systems, who is the Chief Executive Officer, and he's going to talk to us a little bit about mental health resources in Flint. And Kristen Stevenson's going to start us off. She's the project manager with Greater Flint Health Coalition, who's going to talk to us a little bit about Flint ReCAST. So thank you so much to everyone for being here today. We've got some really wonderful expertise. I'm going to bring Kristen up first to talk about Flint ReCAST, which is awesome. Thank you, Kristen.
Hi, happy to be here.
Awesome. I know you had some slides you wanted to share. So
yep, I'm going to share my screen right now.
All right.
My name's Kristen. I am the project manager for Flint ReCAST here with the Greater Flint Health Coalition. And so for anyone who doesn't already know, ReCAST stands for Resiliency in Communities After Stress and Trauma. So really, folks might be familiar with the program from several years ago as a response to the water crisis. It's a federal grant that the city received. And so it's a 5-year grant that was done once, and now we're in the second installment of a second grant of ReCAST. And so here at the Health Coalition, we partner with the City of Flint as the implementation entity for ReCAST. And so ReCAST is all about assisting high-risk youth and families by supporting the recovery and rebuilding of Flint's vibrant community. And so what that means is we do a lot of work around mental health awareness and action. We support lots of community organizations in providing programming to youth and trying to build resiliency. We partner with GHS to do, I'm going to talk a little bit about some of the trainings that we work with them to do. And then folks might be really familiar with our mini grant program that we launch each year. We're just finalizing all of the contracts with 15 organizations that are generally youth or family serving programs, all about teaching trauma-informed skills and building resiliency for families. So we'll be launching kind of an overview of all of those programs that are being funded this year soon on our website. So you can see our website linked here on this flyer, flintrecast.org. You can also email us at recast@flint.org if you'd like to be on our distribution list. We're always sending out information about what our mini grant organizations are doing. We also share a lot of resources that are also available on our website. I definitely encourage folks to visit our website. We've created this sort of hub for lots of different resources around mental health and resiliency. We also have a data dashboard we've been tracking really since about 2018, or potentially earlier than that. We've been tracking changes in behavioral health and mental health through a survey that we administer every single year. So that's an interesting space to just see what the changes have been in Flint specifically over the years. I'm going to change my share to a flyer just to show you the trainings that we fund GHS to do. I strongly encourage everyone to participate in these trainings if you haven't already. I think that they're useful no matter who you are. You never know when these types of conversations come up. If you're not, working with the community directly, you just don't know when it could come up in your personal life. So every single one of these trainings are free. Most of them are still being offered online, and a couple of them are actually you do them at your own pace. So if you're interested, go to genhs.org, and then you can kind of search on their website for ReCAST trainings, or if you want to select specific trainings, you can type in the various different trainings. So definitely encourage folks to check out those trainings.
Kristen, can I ask a question? These
Yeah,
trainings,
please.
are they only for people who are in the city of Flint? Can it be anyone who's in Genesee? Like, who can register for and take these trainings?
Honestly, anybody can register.
Okay.
We're not we do track who is registering, but our program ReCAST is focused on Flint, but we're not, turning people away if you do register. We, like I said, I think the trainings are useful for anybody. So if
Right.
you don't live in Flint, definitely feel free to register.
Fantastic. And then do they do groups? Like if someone,
Yeah,
okay,
some of these are group trainings. Others, like the Living Works, is a self-guided training that you do on your own. The other, Suicide: The Ripple Effect, is actually a movie that you watch in a group and discuss. And the rest are also, I think they're all group settings for sure.
fantastic. Thank you.
I'm going to talk a little bit about another activity of ReCAST that we have coming next month. If you guys haven't heard about it yet, we're having the Strong Summit. So again, folks might be familiar with in past years ReCAST, the ReCAST team did a couple of years of they call it a little bit something else, like a Resilience Summit, you might have heard. We kind of have rebranded it a little. And obviously we have a whole new team, and we're just putting forward a day of just connecting and learning and trying to encourage mental health action in the community. And so we're really excited. All day long, Thursday, May 18, we're going to be at Factory One. It's basically a conference that we're doing here, right here in Flint. And we're going to have lots of breakout sessions. We have some really exciting speakers that I'll show another flyer for. And then we have excursions. So you can see on the flyer, we are doing mindful kayaking, hiking, and biking. There's an option to go to a salt spa in Grand Blanc, as well as an urban garden tour, and also a racial healing circle is one of the options for excursions. So these are all activities that you can choose to participate in if you do attend the summit. They're not required, but they sound pretty exciting to me. And so throughout the day, we'll have, in addition to those, I'll just mention our speakers. In the morning, we're having Dr. Joe Johnson, who's a nationally recognized speaker, who's going to be coming just to kind of kick off the day with a lot of energy and excitement around, just like it says, unleashing your purpose. So we're excited to welcome him. We'll be welcoming at lunchtime a gentleman, David Kennedy, who's a professor of criminal justice at John Jay College of Criminal Justice in New York City. We're really excited about him too. He's going to be leading a kind of discussion around community violence and intervention and all the work that he's done around that in the country. And then followed by David, we'll have a panel of local folks who will be talking just about their experience around community violence, incarceration, and the effects on their mental health. So excited for our lunchtime panel. And then in the evening, we have our local friend, Sean Hart of Involved Dad, who's going to be speaking. Our evening reception is going to be at Tenacity. And Sean, we're just super excited to have him join us to kind of round out the day and give us our closing for the day. And if you register soon, we're giving the first 100 people a copy of Sean's book, From Average to Elite. So register soon, you'll get a free copy. And I will, if I can, I'll put the link to our website. We have a web page for the summit. I'll put it in the chat because I would love to have folks get registered today. And that is kind of my spiel. Do you want me to answer any questions?
I'm just checking the chat to see if there's any questions. No, this sounds like a really great event that's going to engage the community. We're really excited, and thank you for talking a little bit about it.
Absolutely. Yeah, we're really excited. We've got lots of partners, lots of community organizations that have sponsored us. So we'll be posting about the various sponsorships over the next couple of weeks. And we're putting a lot of time planning into this. We want it to be an annual event. And so each year it'll be a little bit better and a little bit, more exciting, hopefully. But this year especially, it's been since before COVID that we were able to do something like this. So we're just really excited to bring this to the community. And it's for everybody, you know, it's not professionals, residents, community members, anyone is welcome to join us.
Fantastic. Do you have, if you want to shout out some of your community partners?
Yeah, I will. So like I mentioned, the city is the kind of owner of the ReCAST grant, the Health Coalition, we're the implementation partner. We also partner with Genesee Health System, so you're going to be hearing from Dan shortly after. We love, obviously, I mentioned all the trainings that they do. We also partner with the CRIM Fitness Foundation. We love to support anything around mindfulness, and so we love them as a partner. They're also helping us plan the summit, as well as Michigan State University as our evaluation partner, Dr. Rick Sadler. And then as far as the summit goes, I can name our #1 sponsor because they're it's kind of news now. Our biggest sponsor for the event, we're really excited. The Community Foundation of Greater Flint has been a huge contributor to the summit, as well as many other sponsors, like I said, that will be kind of sharing through our social media and on our website over the next few weeks.
Fantastic. And then do you want to throw your slide up one more? Oh, good. You put the link in the chat. That's
I did
great.
put the link in the chat. I will put the slide of our
just so people remember.
Yeah.
Yep. Flint ReCAST. That's
yeah.
perfect.
Like I said, we're also on our website is a great resource space. Encourage folks to check that out and browse around there. We just updated it last year. It's really, I think it's really fancy. We also have Facebook, Instagram, Twitter. Facebook is probably where we're the most active. We try to share as much as we can about the different mental health trainings that I was just talking about, as well as other resources and the various activities of our mini grant organizations.
Fantastic. And then just the date and time of the summit. If you go back to your summit slide.
Yes, the summit, Thursday, May 18
there we go.
At Factory 1. And it is limited. So I would say, in addition to trying to register in the first 100 to get a book, we also have to limit the number of attendees just because of the space
and the activities.
So, yeah, and exactly. So we'll definitely encourage folks to register sooner than later.
Fantastic. So for the mindfulness and some of this stuff, CRIM has been on the webinar several times talking about mindfulness resources. Are they the ones leading some of those mindfulness sessions? Yeah,
well, definitely. We're going to have some presenters from the CRIM. Definitely, the CRIM staff are helping do the mindful kayaking and mindful hiking excursions. And then we'll also have at least one, maybe two mindful moments throughout the day that CRIM will lead. Fantastic. So yeah, we're excited to, be able to incorporate them and all the work they're already doing.
Yeah, sounds like such a great day. Thank you so much for sharing so much about the resources that you all have for the community. And I think the summit's going to be such an amazing event. Don't forget to register so that you have some time, you can keep your space and get your book. And maybe, is he signing books at the event?
Yeah, I don't want to commit him, but I think he'll do it. I can't speak for him, but I'll be asking him to do that for sure.
Yeah, that sounds amazing. Thank you so much, Kristen. I know you have a 12:15 hard stop, so I want to let you go, but thank you again.
Thank you. Thanks for having me.
Yes, absolutely. That's a perfect pivot because we're going to pivot right into Dan Russell, who's going to talk a little bit about some of Genesee Health Systems resource. And it sounds like you're such a big sponsor of the summit that's coming up, and you're providing a lot of resources, and Genesee Health Systems is. So thank you so much for all that you do for the community.
Oh, thank you. And thank you for the opportunity to talk here today.
Yes, absolutely. So tell us a little bit about some of the work that Genesee Health Systems is doing in Flint. And I know we want to save some time to talk a little bit about some new endeavors that you all have with a couple of grant funds that the mayor a lot of grant funds that the mayor described in a press release that happened about a week ago. So if you would give some context a little bit for what Genesee Health Systems is doing in the community and maybe talk a little bit about that.
Sure. Thank you. Again, thank you for the opportunity. Very, very happy to be here. Genesee Health System used to be Genesee County Community Mental Health Center. So we are nationally what's known as a CMH, or Community Mental Health Center. And there are 46 of those in Michigan and roughly 5,000 or so CMHs across the country. And we're all basically similar, although we're all have a local flavor to us. So we do a lot of mental health, behavioral health, developmental disabilities, substance use, and Genesee Health System is a little unique in that we also do primary care. We're also a federally qualified health center. So we have a basic core of services that we provide. And then recently, the community supported a mental health millage in May of 2021. And so we just started, we're just finishing up our first year of that. And with that, we're able to do a lot more in the community. We're getting very active in the schools. We're developing mobile crisis response for the schools. We're developing a 24/7 crisis center, urgent care center. So a lot of things that we normally wouldn't be able to do because we're Medicaid funding, which is very restrictive. The millage is allowing us to serve a lot more people. One of the things that we're really excited about is that we recently received a teaching health center grant. And I'm going to talk a little bit about that in very, very broad terms because it's a little complicated. But we were able to receive this grant because in addition to being a mental health center, we are also a federally qualified health center or a primary care center. In Genesee County, there are two of those, Hamilton Community Health Network and then ours, which is Genesee Community Health Center. So they are available for funding through Health and Human Services. And for the first time, they had these grants that were available to plan and prepare for residency programs. So residency programs are where doctors go. So to become a doctor, and I am not a physician, I'm not a medical person. So other people on the call here.
I got your back, no worries.
more personally about that, although I will offer, I've probably worked with psychiatrists longer than anybody on the call. I think I hired my first psychiatrist in 1979.
I think you're definitely probably probably got more time in than the rest of us.
So just real quickly, and there's usually a lot of confusion between a psychiatrist and a psychologist in mental health,
Yeah.
even with people that are in the field sometimes. So a psychiatrist is a physician, a medical doctor. And the real one big difference between a psychologist and a psychiatrist is psychiatrists can prescribe medication. Psychologists are usually PhD level. They can be master's level, but to be fully licensed, you have to have a PhD. And they also provide treatment like psychiatrists, but they cannot prescribe medication. So to be a fully licensed physician, you have to go to medical school, and then you have to go to a residency program. And that is where you learn your specialty. So you get out of medical school and you decide you want to be a dermatologist, you want to be a cardiologist, you want to be a psychiatrist. There are specific residency programs across the country for those specialties. And a residency program usually lasts anywhere from 3 years to maybe up to, I think, 7 years if
That's
you want to
right.
be a
Neurosurgeon.
something really complicated like that. Residency programs normally are located in hospitals, but because of the shortage of a lot of types of specialties, HHS and the current administration in Washington has opened up this other pathway, which is allowing community organizations to get this planning grant, and then possibly the end of that would be to develop a residency program. So we were able to receive that planning grant because Genesee Health System is also a federally qualified health center. So there were 46 organizations across the country that received this planning grant. We were the only mental health organization to do that. So we're doing something nobody has done before. So this planning grant is to allow us to study and to try and gather all of our experts in the community to see if we can, in fact, develop a residency program at the end of this. So it's the very, very beginning step. It's a very important step because you can't do the next step, which is to actually start the residency program unless you do the planning and arrange for funding. So we will take the next 2 years to do that. We will work with our partners, because we are not obviously a hospital, but MSU, McLaren, the hospitals, Hurley, we will rely heavily on our partners who are experts in this and who know how to do this. And hopefully at the end of this period, we will decide that we can do this and we will go forward and start a psychiatric residency program in Flint, which would be a wonderful thing for the community. Psychiatrists, like all other physician specialties, are hard to recruit. We compete with everybody else in the country who needs psychiatrists, and pretty much everybody needs psychiatrists. So Flint competes with New York City and Miami and California and all the other places. And, you know, Flint is a tough recruit. We have a very difficult time recruiting psychiatrists to Flint. So this is a long-term fix. This is not going to fix anything next year, but for the future of Flint or for the future of behavioral health services in the community, we think this is a good step in that we will be able to train our own psychiatrists, and hopefully some of those psychiatrists will stay in the community. Not everybody stays in the community where you do your residency, but our ultimate hope, my ultimate hope has always been, is that we will train residents of Flint in this program, and they will want to stay in Flint and they will want to help their community. So again, pretty long-term, and a lot of work is going to go into this. But I think we have a good group together and we are committed and we're going to give this a shot.
I super appreciate all of the context that you've provided there, because it's something we hear about a bunch on the webinar, right? We hear about the shortage of mental health providers, regardless of if they're psychiatrists, therapists, psychologists, right? Just generally the shortage of mental health resources and the need for mental health resources. And not because our communities aren't doing an excellent job of providing resources, but because the need is so great in our community that has experienced so much trauma. We are trying to provide necessary resources for the community. And you know this firsthand, and you know, the work of McLaren, MSU, Hurley, yourself, to think about creative solutions for how we solve that problem is really exciting, and really something to be really excited about. Certainly has a long process, right? There's certainly, you know, some work to do, but it's a process that it's sounds exciting and has some potential at the end of it. So that's really great to hear. You mentioned something that I want to ask you about. You said it can be hard to recruit people, and I have some context, but I wonder if you would share a little bit about what has happened in psychiatry, right? So there's been some shift in all medical fields towards some telehealth, and certainly that isn't helping the process of recruiting. And I wondered if you'd share a little bit about your thoughts on why it's been so hard to recruit people.
There's a shortage of psychiatrists anyway across the country. Everybody is looking for psychiatrists. You know, we look at ads all the time. And again, we compete with the big cities and the resort areas. You know, and Flint has some challenges, certainly. And we look for people who are committed to the mission. And, you know, we're doing okay right now. We have a good crew of psychiatrists now, but in Genesee County, I think they usually say that the average age of psychiatrists is about 56 or 57. I think it's pretty similar with a lot of the specialties in physicians. The population is aging and they're not being replaced at a rate that keeps up with everything. Now, fortunately, admissions to psychiatric residency programs has shown a pretty good increase over the last several years.
Yeah,
it is going up. I think the interest in mental health, kind of with everything that's going on, has helped that. So it used to be, if you wanted to go into psychiatry in medical school, you kind of got looked down on. Got made fun of by the other docs that were going to go into cardiology, and they were going to be surgeons, and they, you know, I've had people tell me, yeah, they used to laugh at me and call me, you know, fuzzy and, you know, Dr. Feelgood kind of stuff. You know, I think there's still a little bit of that there, the whole stigma of mental health, but I think that is better now than I've ever seen it. You know, mental health is gaining respect. I think a lot of this through the pandemic, everyone has learned that everybody struggles, and it's okay to say you have mental health issues, and it's okay to go get treatment. So I think that has helped. So more and more docs are going into psychiatry. So hopefully we're going to get to the point, somewhere in the future with this, where in Genesee County, you don't have to wait to see a psychiatrist.
Right.
Right now in the private sector, the wait is pretty good. And I've done that. We don't do a lot with the private sector, but I have tried to find appointments for friends that need it and know what I do. And it is tough. It is tough to find a private psychiatrist where you don't have to wait a long time. And that's just not right. That's just not the way it should be.
So we've talked about two things, right? We've talked about an aging workforce, which means that our existing psychiatrists and mental health professionals are sort of aging out to the workforce, and we're expecting at some point will retire, like as they should, right? As they should get to enjoy their retirement too. We're talking a little bit about some trouble replacing that workforce that is increasingly getting better, but remembering, I appreciated that description of the pipeline to becoming a psychiatrist, right? Because we talk about the 4 years of undergraduate training, the 4 years of medical school, and then psychiatrists complete a residency that is 4 years, right? So if you're thinking about post high school, it takes, for 12 years to train a psychiatrist to be ready to go out and practice. And Dr. Gordon asked a really interesting question. How hard is it to match into psychiatry residency programs? I'll answer that a little bit as someone who sits in medical education, and it's competitive. It's become increasingly competitive. And I appreciated your comment that, a generation before this generation, it might have been something that we weren't seeing as many medical students sort of elect into, but increasingly we're seeing a generational evolution in the conversation around mental health, right? We're seeing people be really thoughtful and have a lot of respect for the conversation around mental health. And increasingly, we have a generation of future clinicians who are coming in saying, I want to be a part of the solution. And that's looked like an increase in people applying to residency programs. So the match, which is the process for those of you who may not know, is the process by which students who are applying to residency programs select into the residency programs, is, increasingly competitive in psychiatry, because we've got increasing applications into psychiatry, which is great. The sort of last thing that we could identify as a barrier, we've talked about sort of the workforce, we've talked about the aging workforce. There's this other piece in psychiatry that they're affected by telemedicine, right? Like psychiatry, particularly in the outpatient setting, has an opportunity to really compete in telemedicine, which means, sort of your physicians who might want to be in some bigger markets are saying, why can't I just live in a bigger market and do my telemedicine? And why do I need to live anywhere that's not Miami? Right.
Yeah, I talk with psychiatric headhunters every week, and the conversation has changed quite a bit during the pandemic. So the first question is always, what's the salary range? Second question is always, is it virtual or hybrid, or is there a hybrid opportunity? Because somebody somewhere is going to say, yeah, we can hire psychiatrists and you don't have to be in the office. All we want you to do is telehealth. So that is certainly a competing factor that is tough to deal with. And we can do a little bit of that, but we do find that face-to-face is very important in our field. It really is. So that does complicate things a little bit.
Absolutely. That face-to-face, particularly for different, it depends on sort of the mental health need, right? So you certainly need your psychiatrist who can be in the office and can really do that face-to-face encounter. Dan, I really appreciate your time and sharing your resources with us today. Super helpful, giving us some context for what's happening in psychiatry and what the difference is between our psychiatrists who are able to prescribe and our psychologists and our other mental health providers. Thank you so much. Do you have any last comments you want to share with the community?
No, I just again want to thank you for the opportunity to talk. I want to thank the community for supporting the millage. And my hope and my belief is that either I or somebody from GHS will be back here in a couple years to talk about, now we are starting the psychiatric residency program.
That is certainly my hope as well. Hopefully we'll be here together, you know, talking about the joint endeavor between our 3 hospital systems and, you know, all the work that we've put into it, it has come to fruition. So I look forward to that.
Good. Thank you very much.
Thank you. All right. Thank you so much to GHS for telling us a little bit about our mental health resources. Next up, we've got Lynn Williams, who's the Director of Equity and Community Engagement with the Community Foundation of Flint. Thank you so much for coming on today.
Good afternoon. Thank you for inviting me. I'm looking forward to this conversation.
Yes, absolutely. All right, you got your slides up. Fantastic.
Okay. So as was mentioned, I am with the Community Foundation, and I'm talking today about, for short, we call it TRHT. That stands for Truth, Racial Healing and Transformation, which really is an initiative that was housed in the Community Foundation of Greater Flint, but we are really just like we set the table. We're the holder of the work. It is really the community's work. So TRHT is a national effort. It was created by Dr. Gail Christopher. She was a doctor of holistic medicine. She's also an award-winning social change agent. And in, I think, probably around 2014, she was a senior vice president at the W.K. Kellogg Foundation. She created this initiative, and through the W.K. Kellogg Foundation, they seeded 14 sites across the country. Michigan, a little unique to some of the other sites that you'll see on this map. The thing about Michigan is that we could one site, but we had four different places that TRHT was being implemented: in Flint, Battle Creek, Kalamazoo, and Lansing. So again, Dr. Christopher created this initiative, and she actually is widely acclaimed for her work in infusing holistic health and diversity concepts into public health programs and policies, as well as for her unwavering commitment to ending racial injustice in America. Okay, next slide, please. So really, what is TRHT? It's a comprehensive national community-based plan. It's not a program. It's really not one certain thing, but it is a plan that community comes together to address issues that they feel are barriers and structural impediments to changing and getting rid of systemic racism. So TRHT seeks to unearth and jettison the deeply held and often unconscious belief that there is a hierarchy of human value, that a group of people is superior to others based on characteristics like race, like gender, and you could name, I know that everyone on the call could probably come up with a list of other areas in which we face this issue. So TRHT is seeking to do this. Jettison, Dr. Christopher purposely picked the word jettison to describe this work, because her goal is that we find something that, well, she was a Star Trek fan, first of all, because I think that's the only other place I've ever heard that word. And her goal was to, as in Star Trek, to jettison, to blast off the face of any existence racism. So that's what not just to say or to decrease, but really to get rid of racism in our country. Next slide, please. One of the pieces of the TRHT framework is called racial healing. Well, the whole undertone of the framework is about racial healing. So what is racial healing? It's recognizing past and current trauma. It's recognizing the history. It's recognizing the fact that the country was created and with systems that had embedded systems of inequity embedded into it. So it's recognizing that, coming to an honest reckoning of that, and then being intent on creating our own journeys of healing. It's a process that requires listening, acknowledging mistakes, building accountability. It's a process that people and communities develop for themselves. So what healing looks like here in Flint is very different than what it looks like in Lansing. So our programs are very different. Racial healing is unique from, but it is connected to DEI. You hear DEI all the time, diversity, equity, inclusion, and justice. It is another piece. What racial healing does is, I call it, it sets the table. Racial healing is about creating relationships that then make it possible for us to work together more strongly and more focused and entrusting relationships to then dismantle systems, that systems of oppression. Next slide. So the framework, and this is a little hard to see, but I'll just tell you. So the motto of TRHT is that above everything, one of the biggest needs is for narrative change. Narrative change, the dominant narrative has been perpetuated through all parts of our community, entertainment, through the entertainment industry, through monuments, through institutions. There's a dominant narrative that, again, because it was embedded into the creation of this country, there's a dominant narrative that lifts up one class, or not class, but lifts up one type of people, and people of color and other marginalized groups are either not seen in the narrative, or the stories are not fully told. So narrative change is really critical in TRHT, bringing about honest and accurate descriptions of our lived experience, and unearthing the full history and the richness of the people of our community, so that we can then begin to see our common humanity, common threads. The next level of overarching theme of the framework is that racial healing and relationship building. Racial healing, the thing is that bringing people together across differences, whether it's sectors, whether it's race, ethnicity, gender, bringing people together across differences to really sit and listen and learn and share their own lived experiences and truth as it relates to race in our country, is what racial healing and building the relationship. And why is building a relationship important in the work? Building a relationship, strengthening relationships are so important to any type of work like this, because what happens is, as you really get into the meat of the work, get into the meat of working to transform policies or systems, there's bound to be tension points and barriers. Many efforts have fallen apart once groups hit the tension point, because they haven't really taken the time to build the trust in each other, that we will have each other's backs, that we will have each other's best interests in mind, to work for the best, for the whole. So that's why racial healing is critical. And that's in this framework. And that's the piece that really makes the whole framework different than simply an anti-racism or anti-oppression education initiative. And so with those two, narrative change and racial healing, really with a solid foundation in those two things, we're able to go into and bring resources to sectors, to buckets where the most deeply entrenched forms of structural racism show up. So the area of separation is one of the main ones. Separation, it it's a matter of, how we live separately, why we live in separate neighborhoods, decolonization, housing, but it's also a matter of things like health. Anywhere where we have separation of access to resources or access to well-being. And then another pillar is law. So we can use these narrative change and racial healing tools and practices to then focus on law. Because again, there are deep entrenched systemic racism in how, or an oppression period in how people are handled within the law system. So areas like law enforcement, we see every day differences in how people are treated, groups, safety, criminal justice, juvenile justice. And there are others, and there are overlaps in these categories. And then the third pillar of the framework is economy, because again, how is it? I think economy might be the most clearly visible way in which we see how we are separated. We have different classes. We have different people have different access to employment, to work, to wealth. So, we are at the Community Foundation are committed to bringing or making resources available to provide support to efforts within any of these areas. Next slide. This is really what it looks like. So in the center, you see local coalitions, and we do the work here, not just with coalitions, but we love to do this work with coalitions. We also love to do it with organizations, with community groups, cross-sector groups. But the idea is that the local coalition or the local group that is seeking transformation, seeking to forward or advance some type of initiative around transformation, if they are armed with truth telling, and we can help with resources that like speakers and workshops, they're armed with truth telling, and then racial healing. And we have something we call racial healing circles, and we have local trained practitioners. Some of them on this call, Kristen is one of them on our team, and she's really good. So truth-telling efforts and racial healing efforts together will strengthen a local coalition to then be able over time to be successful in their efforts to bring about transformation in law, in economy, and separation, transforming structures. Now we're realistic, we know it's not something that happens overnight. We've been working at this and really learning and getting our arms around this since 2017. It's not going to happen overnight, but constant work in this area, we believe, will bring about transformation. And the real key is bringing our hearts, and this is where the relationship racial healing is going beyond getting in a head space and trying to create solutions to a problem. It's about bringing our hearts, bringing ourselves into the heart work along with the head work. Over time, we believe will help lead to transformation. Next slide. So Racial Healing Circle is one of the more tangible programmatic pieces of our TRHT effort in general. And it's a storytelling, it is a group of people coming together to share and listen. But these are curated conversations by a facilitation team. They're prompts that are designed to bring about a greater awareness of not only who we are, but how, and not only how we may have had different experiences, but that at the end of the day, across our differences and experiences, there's still a common thread of humanity so that we can embrace ourselves and we can see ourselves in one another and have more empathy as we're working toward policy change. Next one. I think I'm getting close to my last slide. We can skip this slide, skip that slide. I thought I took that out, but we can. And then this is touchstones. This is just giving you an idea of the principles that we underscore our work with, whether we're doing racial healing circles, whether we're working with community groups and community dialogues, workshops, those types of things. We bring what we call touchstones, and it's really a list of things that help us build community, help us build trusting relationships while we're engaged, and again, help us see our common humanity.
Walk us through some of these, because like I feel like this is really important. Part of we have Genesee Health Systems, we've had the CRIM come talk us through mindfulness and what it means, but part of the engagement in this process, it feels like, is starting with being present, right? Is like, set all your distractions aside, come with your full self. So just, if you wouldn't mind walking us through sort of what are the principles that people need to come with to be really engaged?
Oh, sure. I would love to do that. And I will say that since we have been using these touchstones in different places, we've actually seen changes in the way people work together just by putting these out in the room at the beginning of the meeting. So for instance, the first one is be 100% present, is extending and presuming welcome, really understanding that everybody has a lot of distractions, but for the time that we're going to be there, to really give a person a gift of paying attention and welcoming each other to the work, to listen deeply, listening more than just to the words, listening more than just to hear, but to listen to the feelings underneath the words really helps, again, build an appreciation for each other. To understand that it's always by invitation. People are invited to share. You're not forced to share. And within the racial healing circles, for instance, there are different ways in which there's a big circle sharing, but there's also one-to-one pairing sharing. And each person decides, you're not forced, but you come to it knowing that there's no fixing either. Racial healing is not about pointing fingers. It's not about who's right, who's wrong, or fixing each other. It's really, or setting each other straight. It's not about that at all. It's about sharing and hearing people's truths. So suspending judgment is important. Understanding that we all have assumptions that we bring. Sometimes they're invisible and unconscious that we bring to the process. Is important as well. So these are some of the principles. There are others, but we try to, so you see them here, identify assumptions, speaking your truth, owning your truth from your own point of view, respecting silence, which is a hard one, but sometimes time to reflect on what is being said, on what is about to be shared. Maintaining confidentiality is always important, that it helps to create a safe space that allows people to open up. Some that we added in Flint that we added to this list. When things get difficult, turn to wonder. If you find yourself in disagreement, instead of shutting down, instead of being judgmental right away, try to wonder what this person is feeling right now, or I wonder what my feelings about what they're saying is. What does that mean? And then just encouraging people, because beyond the sharing and the learning, eventually we get to the point where we're working to brainstorm and bring solutions to deeply entrenched problems. We have to be willing to embrace possibilities, be bold, put our ideas out there, and suggest and try new things. So that is, again, in a nutshell, what TRHT as a whole. Again, one of the most portable parts of it is racial healing circles. We conduct racial healing circles throughout community. Again, we've conducted them for institutions. We did racial healing circles with the Flint Police Department and the Public Safety Task Force. We've done them for organizations like Habitat for Humanity. We even have done racial healing circles at the Community Foundation for our staff. We're about to do some with our board. And We, excuse me, my phone is ringing that I don't even know how to operate that phone. I'm not a tech person, and I wasn't here when they installed these high tech phones. So, but we have also done them. We did racial healing circles with some of the county staff, with the DEI subcommittee of the commission at one point. We're willing to do them as requested, and we're also looking to recruit more people that are interested in this type of work that may want to be trained as racial healing practitioners.
This is such excellent information. And you talk about the many different organizations that you've worked with. Can you tell us a little bit about what does the pre-conversation look like with somebody's team when you're saying, group, I'm going to bring in these experts who are going to talk about racial healing, transformation. Do you have any suggestions around how you have that conversation with your team that you think, you know, you're going to bring this expertise, this training in, and do you want to prepare them?
That's a good question. We're really kind of as we speak, we're kind of fine tuning our talking points about what it is, because a lot of times just the name can scare people. But basically the way we have been doing it, it's really been sort of as a response instead of really being proactive, but we are getting ready to move into a more proactive phase in community. But our first phase was response. So people hearing about it and coming to us and saying, you know, how can I bring this to my organization? We're wanting to get more into the topics around DEI and anti-racism, but we don't even know how to start. This sounds like a good starting point, but how do we do it? So we sit down with each organization or who is ever requesting it, and we kind of go through a conversation that helps them identify what their goals are. And then we kind of explain the process. We give them pretty much the overview that I just gave. We really kind of highlight what a racial healing circle is. And then at their readiness, you know, we say, we have the group or the organization in charge identify the participants, whether they're wanting to do it with their staff or whether they're wanting to do it with a cross-sector group. Like with the U of M, we did some circles that had involved community partners in a certain department at U of M, which I no longer remember what that department is called anymore, but it was community. It was where most of the community engagement was happening. So, you know, it is a really individualized, curated process. But we do point out is that the biggest thing we point out is that this is about relationship building. Yeah. This is not about polarization or taking sides. It's the exact opposite. It's bringing us together across differences.
That makes so much sense. Can you tell me a little bit about, like, okay, so how big are the groups, right?
Oh,
like,
good question.
Like, let's say someone has a team of 100 people, right? Would they do multiple racial healing circles?
Yeah, they would. They would do multiple, because an optimal size, I would say at the biggest end of the spectrum, size would be around 20, 24. And then you've got 2 practitioners that will lead the circle. Okay. To the lower end, I think where it will be most effective is 8 to 10. Okay. And so in some organizations, so for instance, with the police department, we had 5 different circles, and those were different days. Okay. You know, so we got different parts of the police department. In other instances, and when we first rolled this out to community, we did simultaneous circles. So we had about 4 circles going on at the same time. Each had their own facilitators and own space. They started the day together with breakfast, kind of ended the day, you know, with some remarks. And the other thing is racial healing circles can be used. It can be used, some groups bring it in, we have this one-time thing done, and then we leave them tools to continue conversations, or it can be done in a series. It really can be suited to whatever the needs and the goals are of the organization.
Fantastic.
And our facilitators can do other things like community dialogues and things like that. So
In the example with the police department where you're doing like the 5, is there a debrief that you sort of recommend? So like you've got these small groups that have come together and they've each had this. How do you then sort of at the end bring those groups together and sort of recognize all the work that the group has done?
That's a good question that we haven't actually worked that piece out
Yeah,
yet.
sure.
We're still developing that.
Yeah.
And we will be developing that really soon, because that piece we weren't able to get our arms around. What we do though, we do offer. And so with a lot of groups, we have done we call a racial healing circle. They take a break and then come together and do a visioning exercise. So yeah, we have done that. We bring them together and there's some questions that we go through, again, depending on what their goal is. Really, the questions are asking basically whether it's an organization, whether it's a city, what does utopia look like? What does it look like when we have jettisoned racial healing?
Exactly.
What do we look like now? Where, what do we need to do to get there, and who do we need to involve? And then what are some next steps? And each group can determine that for themselves based on what they want to work on. And so that's one way to bring people that we have.
And that's exactly what I was getting at. So after, for these smaller groups, there is this little sort of session that says, like, what does utopia look like for us? I love how you phrase it, right? What does it look like if we got to where we wanted to be? I want to shout out Tanya Battle, who's been in the chat, like, singing your praises. She said she's participated in these circles. They're very needed for the community. Tanya, did you have anything you wanted to say? I know I just see you sort of giving props to Lynn and all the work she's done. You're muted. Uh-oh. She's really excited. Tanya,
yeah, she's
Unmute. Okay.
There you go.
Can you hear me now?
Yes.
Okay. Thank you so much. Yes, this information is so needed. And I actually participated in probably one of the earlier sessions of TRHT through Lynn. I was invited, and it was one of the sessions that we had circles going on simultaneously. But I remember meeting a young lady, and it's just like Lynn said, you bring your heart and you share your heart, and you connect with some, you connect, you find that connection that you may not even be aware that, you just have to have no judgment and keep an open mind, and just allow the feelings to flow, and just open up your heart and be sensitive and understanding and accepting to whatever somebody else may be going through. I am currently also participating in it's a mindful civic leadership through the CRIM. And a lot of what Lynn mentioned today, and you, Dr. Johnson, is a lot of what they're teaching us, as far as just being open and listening, and just the power of silence.
I love that.
And respect people's, their space, and just listen. So this information is, it's just, yes, very needed in our community, and it would open up a lot of minds, and open up a lot of safe spaces for people to be able and feel safe enough to share, and just take it that step further in creating, in learning what our commonalities are.
Right.
I want to say super thanks to you for feeling safe enough to share that with us.
Thank you.
Lynn, before you go, I've taken up so much of your time.
That's
Lynn,
okay.
Before you go, if you could just make sure we know how we can receive the training. That was one of the questions in the chat. Just let people know how they can sign up with you to get this training.
Okay, surely. You can reach out to me, and I would put it in the chat. I'm so slow at this, but you could reach out to me by email at lwilliams, WILLIAMS, at cfgf.org. And just send me an email or give me a call, 810-610-7188. 7507. That's actually my cell phone because, as I said, I hardly even use this phone in my office. So that's the best way to reach me. And we can talk about and set it up. And we're in the process of creating some marketing now that will go out, that'll talk more about racial healing circles, and when we have some scheduled. So I'll make sure that Heather Lynn has it and gets it to you, or someone gets it to you. And again, if you're interested in just want to have a conversation, know more, and possibly consider being a racial healing facilitator, please call me and let me know.
Lynn, thank you so much. We really appreciate
You're
you.
welcome.
Reminder to sign up for the End Nice Bootcamp, Re-envisioning the COVID Conversation. Dr. Shanita Knighton, who's amazing, an infection preventionist, is going to be leading that. You can register at the link. Also, a reminder about those CEUs for our community health workers. Thank you so much for joining us today.